If your quest for longevity feels overwhelming, here's some good news. It starts with one simple daily habit. MitoPure gummies from Timeline. They're the first ever longevity gummies that ignite mitophagy, your body's natural anti-aging pathway. MitoPure is a clinically validated solution backed by over 15 years of research. MitoPure gummies utilize a powerful compound that redefines what's possible for your longevity. MitoPure produces the first ever urolithin A gummies that support your cellular energy so you feel strong, clear, and vibrant. Boost your cellular energy and enhance muscle strength and endurance, all without changing your diet or exercise routine. As someone who loves to stay active, I've noticed a significant boost in my workouts since I started using it. I feel stronger and more energized, and my recovery time has improved dramatically. Better recovery starts at the cellular level. For more information and to order, just go to timeline.com/Hoffman. Use coupon code Hoffman at checkout for 20% off. That's timeline.com/Hoffman for 20% off MitoPure gummies with code Hoffman. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Something a little different today because often we talk about developments on the nutrition front, we talk natural therapies, sometimes we talk about things related to conventional medicine breakthroughs. Today we're going to talk to an expert on medical innovation. He's Professor Kieran Murphy, who himself is an inventor and an innovator in the field of medicine. He's an interventional neuroradiologist at Toronto Western Hospital, and he has developed all kinds of innovative medical devices. He's a prolific inventor. He's filed 60 patents and pioneered new routes and techniques and approaches to complex spine and neurovascular and CSF pathologies. And he's written a great book entitled The Essence of Invention, Medicine and the Joy of Creativity. And in that book, he details his own personal journey, but he also talks about what are the ingredients in medical innovation. And in so doing, he looks at the biographies of some of the noteworthy inventors and innovators in medicine, Sir William Osler, Dr. Semmelweis, who developed the novel notion that maybe obstetricians should wash their hands when going from bed to bed. He was ridiculed for it. And also the developer of insulin, Banting. And so, without further ado, here's Dr. Murphy. It's a pleasure having you on Intelligent Medicine. Thanks very much for joining us.
I'm honored. Thank you. It's very, very kind of you to ask.
It's my great pleasure. The book was fascinating to me. And I learned a lot from reading your book because you have some very detailed and revealing histories of some of the innovators in medicine. So tell us a little bit about your own personal background. What has prompted you not just to be, you could have done your due diligence as an interventional radiologist. It's an honorable profession within medicine. You stick stents and wires and probes into people under guidance. Since it's interventional neuroradiology, it has to do with the nervous system and the brain and the spine to some extent. But you also were prompted to develop all kinds of new approaches, techniques, and devices. Tell us about your background.
Well, so I'm an interventional neuroradiologist. I do brain and spine procedures. I basically never say no. And then you wind up at like 2 a.m. going, why the hell didn't I say no? And often you wind up figuring out a solution to that patient's problem that hasn't been performed before. It may be a route or a technique into the head, get there, or into the spine to get there. or maybe a combination of tools that were developed for maybe coronary use or something else that you're now going to use in the spine or brain. Or it may be that you actually have to go up with something totally new that hasn't been manufactured before. And I think this behavior comes from working in hospitals of last resort. The patients get transferred from one hospital to another to get escalated levels of care. And if you're the physician of last resort in the hospital of last resort, then you're asked to treat very complex people. So, when you're at a fellowship, I was head of intervention neuro at Johns Hopkins. So there, 40% of the beds are ICU beds. And people are really, really sick. There aren't any simple procedures to perform. There aren't any uncomplicated patients. They're looked after by more community hospitals. And here in Toronto Western Hospital is the largest neuroscience hospital in Canada. So we've got 40 million people, as it were, who might get funneled towards here. And in our socialized system, care gets centralized. So we see over 1 million outpatients a year here. And again, I never say no. And we've built a culture around saying yes, because somebody has to help that person. Somebody has to be responsible for doing whatever can be done, and it has to be done safely. It can't be cavalier. It can't be with a nihilistic approach. It can't leave a trail of death and destruction. It has to be caring and compassionate and successful. So that really makes you focus, and it makes you have to invent and create to find solutions. That's kind of the culture I've always worked in. I think this is equivalent to many other extreme things that happen in medicine or in life, and people's hobbies, extreme climbing, extreme activities. So you're kind of pushing your level of medical knowledge. You're pushing yourself morally and philosophically. And it's not work. It's a cause. It's an act of social engagement.
Well, you seem to have thrust yourself into challenging circumstances from the inception. I mean, clearly, you're an outlier because, as a physician, you're outstanding in terms of your ability to think through problems and develop solutions. And there seems to be sort of a drive for you to do that. You write that on a personal level, during your medical training, you took a trip to a Peruvian prison under circumstances where there were hardly any resources. And, they say necessity is the mother of invention. And, maybe that's one of the places where you engage that spirit of innovation. Also, you spent some time in a Tibetan monastery as well as the sole medical provider under very, very primitive circumstances. And so what were those early life lessons contributing to your...
Yeah, well, again, I think it comes from a desire to serve, if that makes sense, right? Not in any monastic way, but I think we're responsible for trying to make a difference. Now, in Ireland, where I grew up, there's a long tradition of nurses and doctors going away, working in Africa, working in Latin America. And often these people came back and were then, integrated back into the healthcare system. So a lot of the folks I worked with had done this in the past. It's really not uncommon. And if you hear an interview with somebody working for a rescue agency during a natural disaster in Africa or the Caribbean, you'll often hear an Irish accent coming back at you. If you look at the employees at the CDC, a disproportionate number of people are Irish. So it's just something we do.
I recently spent some time scuba diving in Cayman Islands, And one of my favorite haunts was an Irish pub, and it was a genuine Irish pub with genuine Irish food and genuine Brits and Irishmen watching what they call football. We call it soccer,
Yes.
8,000 miles away from the mother country. So yes,
Yeah.
there are a lot of
Yeah.
expats in
Yeah.
different parts
Yeah.
of the world.
And I think there's also a tradition of doctors in Ireland being people of letters, right? That physicians are socially engaged in the arts, in writing, in other expressions of culture, in politics, not just medicine, in a sort of a centrist humanist way. And it's not unusual for physicians to be engaged in a broader society. And that's a good thing, I think. I actually worked for about 2 months in a small town west of Dublin as the only doctor in the town right after med school. And so you're there 24/7 looking after people who just knock on the door, whether it be they got kicked by a cow or maybe they had a misadventure on a Saturday night and they might be fearful that they're now pregnant. And you have to deal with all these complex things. And it was a fascinating way to practice medicine. Everyone in town knows your name and knows who you are. And it's lovely, so yeah.
But you work in a big hospital system now. Do you feel that, and you reflect on this in the book, does modern medicine encourage conformity and perhaps stifle innovation with guardrails on what doctors can do? Because what you describe is the traditional role of the physician with a great deal of autonomy and an opportunity for creativity and thinking out of the box. And now doctors are increasingly following guidelines and algorithms. They're monitored by insurance companies, and in Canada, where you practice, by the government insurance, socialized medicine, in effect. So you reflect on that in the book.
Yeah. So look at how you practice, though. From what you've told me at the beginning of this chat, you've kind of moved away from the center of most people's medical practice with DSM categorizations and ICD-9 categorizations, and you look at things more holistically and broadly, and in a more compassionate way with a breadth of vision about what might cause illness, right? I think we have to fight against bureaucracy, frankly. We have to practice good medicine. We have to realize that people are coming to us looking for solutions, and that may not fit into a simple pigeonhole. And that we often treat what we can bill. I hate that.
Find an appropriate code to optimize reimbursement, right?
Yeah.
And treat the code rather than the patient in some cases.
Yes. And let's turn normal human experiences into diseases. Look at the number of high school kids or college kids on Prozac. But anxiety in college is normal. And let's not make it a pathology with putting somebody on a pill for the next 30 years of their life.
Yeah, show me a kid in their 20s who's not experiencing fairly high degrees of anxiety, and I'll show you someone who is probably doomed to a lifetime of failure.
Yes. Yeah. So I think that we build villages in the institutions that we work in as well, right? Even though I'm no longer working in that small Irish town, I've built a team around me that is essentially a little village, and the quality of our life in the hospital is affected by all sorts of people who don't even know that we're aware of their existence. It's the person at the back door who lets you into the hospital. It's the people at the coffee shop who give you the coffee that you drink every day and know your name. It's the old people who sit in chairs when it's too hot or too warm outside, who we see every day and we keep an eye on to make sure they're healthy and well, so we do build these little villages that are our environment that we practice in. And we have to push against restrictions against our desire to treat patients. At Hopkins, I got into enormous trouble for doing off-label FDA, no longer FDA-approved procedures. Classic example is a guy comes down from Hershey, Pennsylvania with a basilar thrombosis. A truck driver gets transferred down. And I needed
blood clot, essentially.
Yeah, clot in his basilar artery. I had to stent his carotids, his subclavian, and angioplasty his vert to reopen the vessels to his brain. And so I went up to cardiology, and their stent storeroom was locked. And I realized I could get through the ceiling into the room because it was just sort of rectangular cardboard things, right? So I got a chair, went up over the top, dropped into the room.
Sounds like a caper. Yeah.
Yeah, it was a bit Mission Impossible. Anyway, you wind up in the stent room. You realize I hadn't thought about getting out of it, but fortunately the door opened from the inside. Went back downstairs. My colleague Philippe and I deployed the stents. The patient did brilliantly. Eventually was discharged from the hospital. I got into so much trouble because there wasn't a billable code for doing all that.
Yeah.
And
it wasn't so much the breaking and entering, it was the violation. No. It was stepping outside the code universe and doing something.
Yeah.
We can't find a code that's applicable so that we can bill the insurance companies or Medicare for the procedure.
Oh, right. I had an administrator shouting at me for doing that. And the hell with them. That's what I'm going to do.
Yeah.
You know? So there's a little bit of the attitude of MASH. Do you remember Hawkeye and those guys?
Absolutely.
Yeah. And that kind of culture, those kind of shows do really influence us and who we want to be. They're really important. For my daughter's generation, it's probably Grey's Anatomy.
Yeah.
That championing the patient, hell or high water kind of attitude within limits of being destructive, but that's really important in medicine.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So listen up. Here goes.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening, and thanks for supporting our sponsors. They are what make Intelligent Medicine a continuing free resource to you. And now back to today's guest, Dr. Kieran Murphy. Well, let's talk a little bit about some of the innovators that you profile in the book. And sometimes, the story is not so clean. We lionize these people, but sometimes their stories are a little more complicated. For example, you stand on the shoulders of a Portuguese neurologist named Igaz Moniz, and he is synonymous with one of the worst abuses in modern medicine, which is the frontal lobotomy, sometimes undertaken with ice picks to treat, quote, insanity. And yet it's kind of a mixed picture because he was a very eminent neuroscientist and innovator. So, how did we reconcile those two aspects of his personality?
It's very hard, isn't it? He's a fascinating guy. He was a neurologist. He was a politician. He represented Portugal at the Treaty of Versailles.
I didn't know. That's a little factoid that you bring to the fore in your book. It's very interesting.
Yeah. He was a very literate, intellectual individual. He developed cerebral angiography, worked with a great team of people around him. People traveled to see him work and then brought back his ideas to their departments. But yes, he developed the route through the superior aspect of the orbits into the frontal lobes. The bone is very thin there, with a sharp object to disrupt the frontal lobes. And he did this highly selectively in very limited numbers of patients. And then some folks in the US began to use it more broadly. and it became overutilized.
Kind of a traveling roadshow almost, where they would, pack up their instruments and go from mental hospital to mental hospital, basically destroying the frontal lobes of numerous patients.
Yes, at a time where there weren't any medications for mental illness, the diagnosis was very poorly judged, I think, and famous family members, such as one of the Kennedy family members, had this procedure and were destroyed by it.
Yeah.
And, it's a very disturbing procedure that we would never perform today. But the other thing he did that was wonderful was develop cerebral angiography.
In other words, the ability to basically inject dye to show the circulation of the brain, and which is a real milestone in discovering, say, if there's a stroke or,
an aneurysm. Yeah.
Yeah.
So it's very difficult to reconcile those things, but then often people will do things like that. Well, humans are complex. We have yins and yangs.
Well, there's this whole mythos of the mad scientist. And actually, in some ways, that touches on the notion of genius and innovation, because on the one hand, you've got people who think out of the box, and then you have, the Dr. Jekylls and the Dr. Frankensteins, who are part of a modern mythos that really kind of speaks to the notion that, sometimes innovation over the edge can be, I don't know, a form of medical hubris.
So it is very rare to come across somebody like Lonitz, who had such a troubling pattern of practice on one side and genius on the other.
A divided legacy.
Yeah, exactly. Wonderful. Yeah. Most of the time, people who invent who are physicians are driven by responsibility or regret. They'll have seen something, a patient dying of something they couldn't treat, and they want to make sure that that untreatable disease is treatable in the future for everyone else, and no other patient has that same outcome. And
you document several stories about how that was the impetus for invention and innovation.
Yes, indeed, even including the coronary stent or coronary angioplasty, probably the most successful image-guided procedure in the world, developed by Grunzig and Julio Palmaz, or the Greenfield filter with Laser Greenfield, who was chair of surgery at the University of Michigan.
Which is, just for our listening audience, Greenfield filter is if you have a blood clot that's causing a pulmonary embolus that's coming from below, that's, from the venous circulation of the legs, say the leg, if you have a blood clot in your leg, it can actually travel up your inferior vena cava and go into your lungs, and this can be fatal pulmonary embolus. So the innovative idea, put a little filter in the vena cava. Simple notion is a plumbing notion, actually applied to the human body, but it could be life-saving.
Yes, and I think that idea of Greenfield also is an example of the power of two people working together. His idea of putting that filter in the inferior vena cava came from a conversation in a bar with a friend who worked in the oil and gas industry.
There you go. It's a mechanical analogy.
There was sludge in pipes, and they controlled it by filters.
Yeah.
So often the inventor has a friend who helps balance or brings other skills to the table, and the two of them together are more functional than one on their own. And this could apply to Lennon and McCartney. It could apply to Wozniak and Jobs, or Allen and Gates.
Mm-hmm.
Many combinations of people are seen that are the brothers behind the Stripe software. So the two of them are more successful than the one of them would it be.
And there are also examples in your book of people who subject themselves to all manner of medical mayhem to experiment with their procedures or their ideas. People who inject themselves with deadly pathogens people
Right.
like Barry Marshall,
Yeah.
who swallowed the bacteria that he claimed caused ulcers and thus induced an ulcer. These are some really interesting cases because these folks are really all in on their theories.
So self-experimentation is common in medicine. I've done it. You've probably done it. And
All the time. I am my own guinea pig for, especially nutritional supplements, various diets, exercise practices, things like that. Yeah.
yeah. And there are many examples. And in some ways, who better to give informed consent
Exactly.
than yourself, right? So, but I think there are wonderful examples. I think one of the best is Edgar Pask, a anesthesiologist who was concerned that fighter pilots in the Second World War were landing in the English Channel unconscious in their parachutes, floating on their face and drowning. So he wanted to develop a life jacket that made them float on their back. And he did this by having himself intubated and ventilated and thrown in swimming pools in Newcastle until
While under anesthesia.
under GA. Yeah.
Yeah.
Yeah. And until he developed a life jacket where he could reproducibly lie on his back and not drown.
This is during World War II. Yeah.
Yes. Yes. Magnificent. Barry Marshall, certainly, with H. pylori. Now, Barry Marshall also experienced tremendous rejection of his concept by the status quo, right? He wasn't able to publish his paper. He couldn't get to present at meetings. People tried to have his license taken away because the medical establishment...
He was hooted down almost like a bad vaudeville act, at medical conferences.
Yeah. And the same with in vitro fertilization. The same happened to that group of people. They were just taunted when they presented their scientific work. And then the worst example is Kurt Sem, who invented laparoscopic surgery. His colleagues thought the idea was so bad, they sent him for a head CT because they thought he must have a brain tumor.
Oh, my goodness gracious. Yeah.
Now, he actually, in later life, got married to one of my classmates from med school, Izzo O'Neill. And so I have access to first-hand knowledge about how he was treated. He wound up working with the IVF folks in England to perfect the egg harvesting that allowed IVF to become successful and was done laparoscopically.
Wow.
Yeah. There's a wonderful movie on Netflix about the beginnings of IVF. It's with Bill Nighy in it, and it captures that kind of rejection. So rejection is common in medicine. It takes about 20 years for a good idea to be accepted. Like my ozone work on shrinking herniated discs. We're coming up on 20 years now since I began to use that technique.
Hold your thought right there, because I want to talk a little bit more about that, because this is a fascinating area of medicine. You're such a prolific thinker and an out-of-the-box thinker that you've decided to apply the notion that ozone, which has been deemed a potential medical therapy for many years, particularly in Europe. I think it centers in Germany, this culture of using ozone medically. And you've decided to apply it to your wheelhouse, which is the spine. When we return, we'll talk a little bit more about medical innovation and some of the ways that we can cultivate it and not get in the way of it. I'm Dr. Ronald Hoffman. Our guest today is Dr. Kieran Murphy, and he is the author of a great book entitled The Essence of Invention, Medicine, and the Joy of Creativity. I recommend it to you as a good read. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.